The challenge with primary prevention is that the denominator is everybody. And so you better be really cheap if you're going to deploy something that's going to approach everyone. The notion of secondary prevention, I like a good deal more. So once you've been given a diagnosis, now I have a denominator where the incidence of that disease is 100%. Now I can start to manage the secondary occurrences of the complications of those things a whole lot better. And I understand that if I pick a costly disease, like end-stage renal disease, where we're spending $100,000 a year, or the elderly who live in nursing homes, where we might spend $80,000 a year. If we can identify those patients slightly in advance, and we know who they are in advance, we've got a lot of runway to save money in healthcare. I mean, if you keep someone off dialysis a year, that's $100,000. So if you had a solution that only cost $50,000, that's a remarkable bargain. So if you think about it, that's a pretty good business model if you get to make $50,000 a year per patient, and at the same time save equally that much money to the healthcare system. Gee, that's one of those things where everybody wins. So I think prevention's all good. Unfortunately, for startup companies, prevention is a tough target because the timelines for accrual of data is so long. So I like secondary prevention because you can actually look at particular disease targets that have known time constants of recurrence. You can target the ones where you can expect events in short order and then get outcome data in a time course consistent with your funding.